Okay, now dear all, Dr. Vishal from Vishwa Medical Coaching, and today in this short video, we are going to be learning about the basic difference between the Cushing syndrome versus a disease. Now, this is a very important Viva question which is asked in the exams. Now, when we talk about the syndrome, when we talk about the disease, if you can see in both the cases, the cortisol level, that is corticosteroids levels from the adrenal glands are increased. So particularly if you can see, the symptoms are going to remain the same, but the cause is different. That means if you can see in the right hand side, the Cushing syndrome, which is because of the increase in the cortisol levels coming up from the adrenal glands directly, not influenced by the pituitary gland. There is no relation of the pituitary gland here. So if you can see, it reads out also, the Cushing syndrome is an endocrine disorder in which cortisol levels are too high in the body. But cortisol levels can be high because of the drugs also. If you can see the common causes, there are a number of underlying causes. Like for example, it can be the tumor of the adrenal gland, which can be ruled out by doing the ultrasound of the kidney, urinary, bladder and ureter, KUB, ultrasound KUB. It can also be coming up from the pituitary tumor or a corticosteroid use. Now remember, when it is coming from the pituitary tumor, this will be called as a Cushing's disease. If you can see Cushing disease, the control is coming up from the pituitary gland. Cushing disease occurs when Cushing syndrome is caused by a pituitary tumor. Cushing disease is a particular subtype of the Cushing syndrome, if you can see. So Cushing disease is a type of Cushing syndrome when the cortisol levels are high because of the pituitary gland, because of the tumor in the pituitary gland. So which can also be ruled out by doing the MRI scan, where you can find a pituitary tumor. Of course, the treatment part, it can be different. Cushing disease syndrome, if it is coming up from the adrenal gland, we give certain drugs that we're going to be talking about later, not part of this today's lecture. We can also do the ablation of the pituitary gland, the adrenal gland, or we can taper off the corticosteroid use if it is because of the long-term or high-dose corticosteroids. Whereas if it is because of the pituitary gland, we talk about the transsphenoidal hypophysectomy, which can be the option in case of Cushing's disease. So all depends upon where exactly the stimulus is coming from.